Next presentation will be made by myself, and I will share in a couple of moments my slides. And the topic I have is really quite a, um, I would say, polarizing to some extent society. Therefore, I will be try to be as subtle and as discreet as possible. The pandemic management and privacy concerns. Indeed, today I will try to touch upon two topics. It's the vaccination passports or immunology passports. And the second topic is the businesses, the companies, what they should know, how they should prepare in advance, because we all know that this is not the ending story, and there is new reality post-pandemic or during pandemic reality, and all of the businesses are looking forward to coming back to physical places in one or another way. So these are the two topics I will try to concentrate on. Of course, there are many angles to this discussion and debate. That's why I don't want it to be too broad. So I would not dare to claim that the immunology passporting idea itself is bad. No, most probably it's a good idea, and it has many positive effects, as I will try to show you. The only thing I'm trying to stress is that the privacy narrative and data protection narrative should not be left behind. It should not be left somewhere between the lines, or the thing which will be addressed later on. No, my idea is, and the message I have is that this should be ingrained in the system from the very beginning. It should be among the top priorities, and it should be, as Dr. Ann Kavukian said, it should be already by default ingrained in the system without any compromises on the part of the data protection and privacy. Of course, compromises are always necessary. The first caveat I want to make is about the misinformation and public information, which is vast. And I don't dare to judge anybody, no, but we should be aware that there is so much fake news and so much misleading information which spreads much faster than positive news on this topic, that we need to be careful about that. And of course, we can't be judgmental about that. We need to educate people. We need to raise awareness. We need to spread information and explain, but not to be judgmental. And during pandemic, many freedoms are at least at stake. Of course, I don't say that they need to, and they are sacrificed, but many things and values, societal needs are at stake. And therefore, some kind of balancing, and I will show you, is inevitable. When it comes to passporting, it has, again, many aims and many objectives. And as the passporting, COVID-19 immunity passporting stands out, it's being defined as the document that certifies that individual has been infected and is purportedly immune to COVID, which in the last few months, the concept of this passporting has become popular, since several governments have been analyzing different options how to implement that system on regional or global level. And the World Health Organization also has raised this question, is under discussion, and he recommended for Europe actually to think of pan-Europe immunology passporting system. And it's again under discussion. The idea itself of passporting, it's not a new one. It has many decades in place. And for example, the international one in relation to the yellow fever. And it's not a new concept. But the idea which is new about it is that its implication might become very broad. And it seems that at least now under discussion, the system may become much wider in application. It may become applicable to much more different aspects of life than traveling, right? Because originally the yellow fever, let's say, system was designed to tackle and to contain the virus, or basically disease, on cross-border crossings and on cross-border travelings only. And it was very limited in effect and very limited in scope. Now we see the discussion which would be much broader, and it can be applied to employment, to access to services, to access to life opportunities, and it may have much bigger effect than the ones we had, I mean, the passporting system we had during the last couple of decades. WHO, of course, is spotting this very closely, and on January 15, 2021, the Emergency Committee on COVID-19 recommendations has issued the preliminary recommendation that at present time do not introduce any requirements for the states of proof of vaccination immunity for international travel as a condition of entry, because there are still critical unknowns. Of course, every day is fluid, and the more we live, the more information we get. But still, I mean, at least now it's a bit too much of the unknowns to be sure on positive effects and possible effects of the vaccination passport system. At the EU level, again, this is discussed since last year, and I mean, there are several initiatives at hand. And again, in 2021 February, EU leaders agreed that at such an early stage in the immunization process, vaccine certificates should be regarded solely as a medical document and not used for travel purposes so far. So I won't get into much details as far as the passporting system itself is concerned, because I'm not an expert in the field, of course. It certainly has many pros and many positive effects without question. And this is not the idea which, and this is not the aim of today's presentation. The only thing I want to say is that it has many different angles. And it's, of course, powerful incentive, and it will act as a powerful incentive to vaccinate, right? Whether it's proportional or not, maybe there are other ways to induce people, right, to vaccinate. This is a different question, but I mean, it would have certainly a positive effect. It could also open many opportunities, such as access to certain work and traveling opportunities and so on. It has some cons, and again, the science is going on, and of course we should be very grateful to scientists. They have done a miracle, and it's not about that. The whole thing is about how it will be implemented and administration. The key thing is not about the results, but the key thing is about the implementation. So there are still a lot of unknowns. When it comes to the heart of our discourse and the heart of the narrative around the vaccination passporting, then we see that the discrimination and privacy concerns are raised, and this is good. I mean, this is good that these questions are on the table. And we're here, and there are already some kind of research which shows that introduction of the system may lead to some kind of social division, may lead to some kind of stigmatization, and we need to be very careful about that, because it may easily turn out to discriminatory and social division effects, which of course no society of course wants to achieve. And we have several historical precedents with that, and well, 19 yellow fever precedent in New Orleans, which has created terrible consequences, and it's well documented. Privacy as a concern has many different angles, but there are three most important angles. The first one is data sharing. Health data will be shared inevitably, right, with the businesses, with the pharmacists, with the government. The second item and the second concern is location, where it will be stored. The third one is who will have access to this health care and health data, which is sensitive, and who will be managing that data. And the key concept, as Anne Kavukian has said about privacy, is control. So giving the control to people about this data is fundamental. And of course, as I have said, the system itself should have these concerns ingrained and addressed in the very beginning. Of course, I am not talking about the consent of the person and optionality of this. It goes without saying. When we talk about whether vaccination can become mandatory, it's another discourse. It's another narrative which is not very easy. It's not very easy. It has its pros, it has its cons. But the question, can states require mandatory vaccination, of course, has, again, many different angles. And there are, of course, many different answers to this question. But, of course, we need to look into that from one angle, which I have selected, is the intrusion into our privacy. And, again, effective compliance would only be possible with multiple controls. And during these controls and during these tracking mechanisms, more and more data will be collected about us, inevitably. Not only health data, but migration data, access to services data, trafficking data. I mean, going from one place to another. And it will lead to much more accumulation of data about us, which, again, is not in itself a bad thing. The thing is that how it will be controlled and how we will be in control of that data. And as European Data Protection Board has said, it's highly sensitive package of data, and therefore the data protection assessment, impact assessment, should be made very carefully in advance and not post-mortem. When we talk about the fundamental right to human privacy, or right to privacy, of course, it's covered by the fundamental document, which is European Convention on Human Rights, Article 8, which sets forth a very high burden on the state to intrude into the privacy. There is a case law on state surveillance, and the proportionality test is not very easy for the states to pass. I will just show some of the examples of the narrative which is going on right now in a number of states, European Union countries, on the passporting, not the immunology passporting. And in one or another way, countries, they think that they will have it. And it's not the question if, it's the question of when and how. Estonia is one of the examples, but there are many more examples. And what I wanted to show with these examples, with these slides, is that where the privacy narrative stands in, right? And there are countries where I didn't see that very clearly spelled out. There are countries where it's already at the top agenda. And it's not, I don't say that some countries are better than others, no, but what I'm saying is that in the public narrative, in the public area, you can inspect that some countries devote more attention to that than others. For example, Spanish government indicated it would implement an inverted sort of vaccine passporting by registering those who refused the vaccine and sharing the data with the other European partners in pseudonymized manner. Belgium is in favor of verifiable COVID vaccination certificate on a global or at least EU level, but it's important that Belgium watchdog already reacted and warned, saying that, look, the purpose is good, but it's defined in very vaguely. And I mean, storage term is also defined too vaguely, and be cautious about that. So it's a very good sign that the watchdog has intervened. So the more we see this kind of intervention from the privacy, I mean, watchdogs, the better for the design, and the better for the system, because as Dr. Ann Kovukian said, the pandemic will go away, but the privacy will never go away, hopefully. There are typical security or privacy issues with the vaccination passporting itself. And as I have said, there are many angles, and data sharing, data storage, the data access. It's even important to understand how the mechanics, right, of the barcoding, right, or I mean, scanning of the documents will look like. And well, security experts, they raise hands and they say, look, both barcodes and QR codes have huge security implications, as they can be cloned and hacked, with the latter being subject to a process called tagging. And again, this are already the loopholes which are known right now. So these are for sure something which needs to be addressed, not afterwards when we see, but already now in advance, knowing that the barcodes and scanning of the thing is one thing, of scanning the boarding passport. Another thing is scanning at the entry by airlines or wherever your health passport. Right? Everyone understands that interfering and intrusion into this data has, well, obviously different repercussions and implications. And even if boarding passport data is interfered, of course, everyone understands that this may have consequences, but just think of health data. Business, micro perspective. Businesses also are concerned because first of all, they plan how they will reopen, and compulsory testing optional testing, the same compulsory vaccination, optional vaccination, what kind of information business may require to disclose from employees, how interests of different employee groups will be reconciled, and how de facto it will be implemented. So business is looking for some guidance from the state. Business is looking for some regulatory guidance. Uh, at the moment, there is none. At the moment, there is none, with few exceptions, at least in Lithuania. And we have some labor law perspective, which says that risk assessment before introducing the health-related measures at work is necessary. Transparency, consultants, and notification to the employees is necessary. And in most of the cases, it's designed and based on the optionality, on the free consent of employees. But we all understand what free employee consent means in the employment narrative, right? So we need to be careful here as well. So, but all in all, businesses, I mean, there are some laws, for example, law on prevention of controlling communicable diseases, which says that there are a list of works and functions which may be subject to testing or health, examination, and there are consequences which the employer company may apply to those who refuse. Everyone has the right to refuse, but there are consequences said in that law. But in terms of vaccination, in terms of immunology passporting, there is no guidance so far. And just to remind you that Lithuania is among the countries in the Europe where we have optional system, not a mandatory system, and for vaccination. So it's very unlikely that, well, it will come, mandatory vaccination requirement will come soon. Therefore, businesses is in a twofold situation. First of all, they have no guidance and they are left alone with their decision and with their risk assessment and with some kind of risk assumption. And in one way, it's good because different companies will have different policies and which will lead to the most adjusted situation for each and every company. But of course, different policies may lead also to discrimination and different standards. And there is also a legal risk, which the companies will need to assume, let's say, putting the JAB clause in the employment agreements, right? It will be tested by the courts at the end of the day. And the companies have this question: what to do, whether we can require the employees right now, whether we can include these kind of clauses. And there is a lack of legal certainty and HR certainty, how to mitigate these kind of risks. Unfortunately, there is no one good answer. And one good answer is, of course, make the data impact assessment, make the risk assessment, have very clear reasons on why you ask specific vaccination data from your employees. You can't, in any case, compel employees to tell you, but you can explain them why you're asking them, where it will be stored, what you will do with the documents and data you receive. But be mindful. The situation is quite fluid about that. In a few months, it will change, and it may change, and therefore, this kind of vigilance is needed. But at the end of the day, it's up to the company to have these exercises made and implemented in a correct way. The last but not the least is, well, the outlook other companies in the world have already pronounced, or they have plans to pronounce some kind of vaccination tracking system and requirements. We have IBM announced the digital health pass, which will enable employees, customers, and visitors to share the vaccination health status on their smartphone in advance, so that they are either granted or denied access to that business location and so on. There are many initiatives, and of course, many more will come. So thank you for your attention. My idea was to shed some light, to provoke some questions and to raise the questions, and be aware and be in control of your data.